be going through, you should be quick. Maybe the other things, these others will be using the video, they will be following the procedure manual. Yes, they mainly it's just the procedure itself. So most of the things that you are supposed to do, it's things that you have done when you are doing your wound dressing. Right? So whatever prerequisite, what, mostly. Maybe just read through quickly. Well, let me see what I can go through. Then the other stuff I'll give her. This is removal of suture. It's a lot. So, wound suturing, we also refer to this one as the. I think we can start. I think I'll see.
I'll start with recording.
So, good morning once again, class. So today we are going to look at, we are going to demonstrate how wound suturing is done. We also call this one as simple suturing. So wound suturing, I'll go through the procedure manual briefly. The definition of wound suturing is a stitch or series of stitches used to close a cut or a wound. So prerequisite knowledge and skills, what are you supposed to know before you start, you go into this procedure. So before performing wound suturing, you as the students should interpret element of infection chain, universal precaution of infection prevention, basic knowledge of general anatomy and physiology, because I think we'll go through this, especially when we start injecting or giving of anesthetic drug or lignocaine. Okay, so wound infection, it's important, these are sterile procedures. Okay, so there is no need for us to start complaining sterile procedures are like this. In fact, what you are learning now should be in your blood, because I've seen people that would do things when they are with someone, they would pretend, oh, they did. If you touch anything that is not sterile, you can always correct it. If you are wearing sterile gloves, remove them, wear another pair, okay? Because we don't want the patient that we are dealing with now to come back with an infected wound, then knowing, especially if they found you, that I think I did something that was not right. So it should be in your blood, such that even if you are alone, you do something that is wrong, you have to correct it. Do not get to the patient. So that is the element of infection chain. It starts with you, whatever that you are doing. Okay. So universal precaution of infection prevention, that we know. What is the purpose? We want to protect the wound from microorganism contamination, aiding homeostasis. There are certain wounds that homeostasis is just supposed to, or blood clotting should be just on its own. But if the wound is too big, you need to aid this homeostasis by suturing or closing the gap that is bleeding. Okay. So promotion of healing through alignment of tissues. I think, yeah, we were together when we were doing some. In general pathology, we talked about inflammation. Somewhere in anatomy, we talked about wounds and healing of wounds. If you leave the wound that is open, or you leave the wound that is open, leave it to heal on its own, that is not going to be okay. So we need to help it, close it, bring the edges together so that healing can take place properly. Okay? So that is promotion of healing through alignment of tissues. Then minimizing scar formation. If you leave the wound just open as in open, the scar will not be good. Right? Remember the cosmetic part of individuals. These wounds can be anywhere. If it is on the forehead, then someone remains with a very big scar. People will be running away from them. Right? Or you'll even be running away from yourself when you go into the mirror. Then you find that you have a big scar. So we need to help and just minimize the scar that will form. So the indication is clean open surgical wounds. deep and skin layer. So it's just the skin layers that we are doing because we are calling this one as simple suturing. Right? We are not touching any other organ. It's just the skin, and this should be clean. Why? We don't suture a wound that is dirty. Right? We don't suture a wound that is contaminated because we are closing in microorganisms that will later on form pus and the wound is going to be bad. We don't close the wound that is the wound that we suspect there may be microorganisms or it's dirty, we don't close it. What are the principles? Maintain aseptic technique during procedure, use sterile equipment, ensure clean environment. The dressing should completely cover and protect the wound. Minimize talking during the procedure. Close nearby windows, just nearby windows where the patient is. Don't close all the windows because we need the aeration, okay? Assessment, check the type and extent of the wound. Why are we interested in the type of the wound? The wound may be infected, the wound may be dirty, so do not close if that's the case. Ensure the wound is just clean, okay? Clean surgical wound, that's the one that you are going to suture. Determine the type of suture and material to be used. We've got different types of sutures. We'll talk about that later. Assess the condition of the patient, identify patient's allergies. Nursing diagnosis, wound infection, check for this. Gapping of the wound, chilling patient if overexposed. I'm sure when you're doing any procedure, you do talk to the patient and tell them that don't worry, I will do what, privacy, whatever you talk about. The other thing, do not overexpose the patient, okay? Am I talking to students? Yes. Where are you? Are you absent? Okay, shock due to allergies and scar formation. Planning, prepare the trolley, equipment and everything else. So we'll talk about this as we go on. So the one who was going through this will be helping us just to ensure that we have everything. Now you come to your pack, get your pack wherever you keep them. Please ensure you check the tape, ensure that this is sterile. For how long do we keep sterile equipment? A dressing pack? Anything, for how long can we keep it for us to say this is still sterile? Sorry? I'm hearing the creasing type of answer. You remember it? Does it increase or decrease? So that's what I'm hearing. Can I have the answer? For how long? Yes, it's days plus or weeks plus, but how many days? 14 days. Yeah, because a pack will always have a date. Because if you are being assessed, you will tell your assessor that, oh, this tape was cream white before it was taken for sterilization, now it is dark brown, then the date indicated here is within 14 days, so it is still a sterile pack, right? Okay, let's open our sterile pack. Usually this will have something tight here. So opening, we don't cross over. That's the emphasis that we make when we are talking about it. Cross infection, the chain of what, do not cross over the sterile field. Your hands are not supposed to cross it. So if I see that these are the ones that I need to start with, I can't push them this side, I need to go around, right? Yes. That principle, you know it, right? Yes. Okay? So open it like that, then you have to go around. Don't get tired. What are we doing? We don't want to transfer any infection to the patient. Of course, I washed my hands. You saw me washing, right? Yes. So I was touching with my bare hands there, outside drape. But for this one, I need to use cheater forceps, right? Yes. So picking, when I'm picking too, it's the same way that I talked about. I can't minimize talking. Anyway, I have a mask. That's the advantage. Since I'm teaching, I will do the talking. I remember during our training, when you have an instructor, because we'll be asked questions as we are doing this. Then if the instructor asks you too many questions, you remind them of the principles. You say, we minimize talking. You know, we are just running away from patients. Eh? Yeah, that principle, we used to use it a lot. Okay, I'll stand this side for the sake of demonstration, otherwise I was supposed to be this side. Start arranging this equipment, like we said. Whatever you use first, if you are the one who prepared this, you'll be confident you can put everything together this side, right? But if it was not your pack, people can pack anyhow. So we need, the first one that we use is a drape that will cover this part, right? So these can be here, it's fine. This can be here. So I'll put my needle holder, I think for the top shelf, it's one of the requirements. Your needle holder. Then you have your toothed dissecting forceps. Then you have your stitch scissors. So like we said, it's better you do most of the things, unlike you using, I'll put my assistant here. My assistant will work at a certain time. Okay, so what I can do without the assistant or without troubling the assistant. What do I need right now? I'll ask my assistant to just help me with the gloves, but since the assistant is also learning, because we need to have surgical gloves, I'll just help with these instructions again. There are always instructions on different types of gloves, right? So this one is saying, my assistant can read.
Tear down to open.
So there's even an arrow. So tearing, you go down like that, okay? Then I have to receive this from my assistant. So I'll allow my assistant to do that. Other gloves will have where you have to open. Just here you separate these two, then open them like that, then give the one who is doing the procedure. My assistant should be very good. So now I just need one sheet of forceps. Remember, I get both, I put one back, right? So you don't have to be throwing things here, otherwise you risk the whole pack touching this part. She hasn't done a good job. It was supposed to go down all the way. Okay? Now again, the way she's doing things, it's like she's even touching this. You know, if there was, so she has to come somewhere here, stand on the side of the trolley, then get this, because as I move this, I may risk dropping it. Eh? Whatever you are receiving, receive from the side. So even these gloves, I need to put them in readiness for use. Right? So just open this one, then get, I think I need the other sheet of forceps. So put them like that, remove them from here so that you don't go and suffer. You don't have to start touching this part like we see during OSCE. Just put them on top here. Everything here must be in readiness for use. Again, so that it's prepared. The suture, I need to get the suture. Everything you're putting here, if you are being assessed, even with the gloves have expiry date, right? So you have to talk to your assessor that these gloves are still sterile, I can use them, okay? So you have to look at the expiry date. When are they expiring? So this one is saying 2030, the 4th month, which is April, right? So it's okay. Then, did we put the sutures here? Sutures, no. Okay, where's our box? Okay, so you get your suture. Even sutures have, in this case, since it's the skin, we've assessed the wound. Since it's the skin, we are supposed to use silk. Okay, that silk again. Sutures have with different types of sutures. For tough tissue, you have to get a suture must be on a cutting needle. Okay, the skin is very tough. So if you get on a round-bodied needle, it will be very difficult for you to suture. you'll be fighting with the patient, you'll be fighting with your sutures. So it has to be on a cutting needle. So even this suture, you have to say, okay, this is still sterile, or from the box, it's still sterile, I can use this suture, so that you don't use expired sutures. So the way I said, the way some gloves are, because most sutures are that way, you don't tear, you have to go this side. Okay, there should be a part that you should be able to open. Now, our sutures, we need to check our expiry date. Okay, it's okay, it's good here. So, the way you open, you just go. Okay, let me demonstrate. Pick one, Chito, for self. Now you are the owner of the procedure for now. Get quickly. You're on camera. So do the right thing. Okay? Oh, shibari. Okay. So, opening, I just want to demonstrate this. I'm supposed to get this. When you're opening, you do like that. You are not supposed to come near this sterile suture sachet that you are getting then. You go on the side, then the owner of the procedure receives it, okay, then drops it on the sterile trolley. You can put it back. So this is where we have problems when you're doing os. This place is Pastor Bruce will accuse me. Okay, since he has said it, yes, it is holy for us. You don't touch anyhow. But you find students in here, regardless of how much adrenaline has been produced, please do not touch this area. Unless you are gloved. Right? But there are people that would come here, you are watching them performing, they will be touching these things freely. Eh? That wound that we are going to is open. Outside here, even if I've washed my hands, even if I go and surgically clean my hands through scrubbing, I haven't removed all. On the skin, we've got normal flora, right? And we know normal flora, once they change their residency, where they will go and cause infection. So from the skin here, what is on this skin here, if it goes inside the tissues, it can cause infection. Then the wound gets infected. So I don't want to get my normal flora transferred to the patient. By touching anything here which is going to get in touch with the patient, I'm transferring. That's the chain that we were talking about when we talked about the principles that you are supposed to know. Okay, so I think I've got almost everything that I require here. So I need to cover this. Even if you are supposed to do this, after you go to the patient, tell the patient that you are going to prepare, or you can do it either way. Let's prepare, then we'll go to the patient. Remember the way we did with this drape. So it's the drape now we need to cover our equipment. So see the reason that you're supposed to do this. So which part, I've opened this, which part is more sterile? The one that is closer to me or the one that's away from me? So that's the part that is supposed to go in touch with the sterile equipment, right? So I can cover like that. Okay? So done. Then we'll get to the patient. I'm sure the procedure of the patient we know. Do we need to go through that? Sir, guide.
Are we safe?
Yeah, we go to the patient, get permission, talk to the patient. Whatever that you need to talk to the patient, talk to them. There's something that I think we forgot. You need to have this, right? So we've gotten permission from the patient. We've talked to the patient. The need for us to go and clean the wound. I don't know if this, where we are going to stand, if it's fine. So even when you are wheeling the trolley to the patient, we've gotten permission, we've come back. Remember, from talking to the patient, I'll come back, wash my hands, right? Wash my hands. Not surgically. How did I forget I was supposed to wear? I was not reminded of this, and I was not told a number of things which I cannot talk about now. So when you are moving with your trolley, you hold here, right? Not up here. Pastor Bruce has told us we are using that term, it's a hold, right? So you wheel your trolley. This is the right side of the patient. It's supposed to be that. Okay, so you talked to the patient already and everything is done. So what do we do now? Since this is covered, I'm by the bedside. What I need to do is go and scrub. Right? Scrubbing procedure, we know it?
Yes.
Okay. For how long are we supposed to do the scrubbing?
5 minutes.
Huh?
Why do you know there is?
I'm still hearing Chris
You
and
want to scrub? How long are we supposed to scrub? 5 minutes.
I was hearing 10 minutes. 5 minutes. Now, the same scrubbing that we do when we are in theater. So in theater, again, there are 2 types. In an emergency, you have to scrub for 3 minutes, but still following all the steps that we do in 5 minutes. Okay? So you just have to be faster. So scrubbing, done. I've scrubbed. The way I will be moving now, I will not drop my hands. I will be moving like this. Again, my hands are not supposed to be above my head, but just between my waist and somewhere by the neck area. So I will be moving like this. I've scrubbed. Supposed to wear something short-sleeved. So now the assistant here you have to tell your assistant what to do. Okay? I'll stand this side. Then I'll ask my assistant, you tell the patient, oh, I'm back now. We're about to start doing this. So, anyway, one step forgotten, still the assistant can help. My assistant can put that Macintosh under the foot or under the leg of the patient. Get them one, the way you get them. Just come, move quickly. Which one goes down first? Just like that. Fold it, it's fine, the way it was folded, since the area is smaller. So you ask the patient, I want to place this under your leg, lift, then push it under. She's supposed to be gloved, right?
Yes.
Yeah, so the wound was assessed and everything else. Put the other one. So it should be folded as well. Everything you are doing, remember you are talking to your patient. So then since she has touched these things, you come back to touch my trolley. She has to go and wash hands, right? Wash hands and dry them. So go wash hands, dry them. You can come back. Come. You should have your own hand towel. It should just be here. Eh?
Forgot your plan.
Okay, so use this. She will stand this side. Since this is covered, hold this corner here. No, stand here in the middle. So hold one hand holds this corner, the other one this one. Then the other one here. Then lift. Remember I'm scrubbed, right?
Yes.
Lift it, fold it, you throw it in the box down here. Lift, you lift and move away from this whole place. So what do I need here? The first thing I need here is what? Then put methylated spirit in this. So the way we do not scrub, but we pat, right? Otherwise we'll have dead epithelial cells all over. Right? Pat with one, the other corner at the back and in between the fingers, then you go all the way round up to the elbow. Right? I'm wearing short-sleeved coat and shirt. Right? Anyone who is seeing long-sleeved?
No.
Yeah. So you do the other one like that. Then the last corner, the goodness you'll be seeing, it will be wet with water. So the corner that you use, you don't use it twice. Right? In between fingers, go all the way down. Then you can ask for the ball. It gives you the ball for the drapes. Drop it in there. Remember, you don't get damp here. Gloving, we know the types of gloving. What's the first one? Open method.
Responding, what is the first one?
Open method is the one that I'm going to use. The second one? The third one?
The third one is what?
You will not go to theater like that.
Eh? The third one is what?
Plunging. Plunging method. Okay, so this is the right one, right? So I'm touching the inside of the glove because it's going to be in touch with my skin. Don't worry how the fingers will go in there. Don't just touch with this other hand the outside, right? So I don't mind if two fingers are fighting for one hole, I'll let them go, I'll sort them out later, right? So I'm still touching just the inside, then I'll let go. Then this part now, since it's the outside, it's going to be in touch with the patient. I need to, this is the part that should go in like that. Then this other finger, okay, is one that remained, goes like that, right?
Yes.
That's what we do. Even during our school, do the same?
Yes.
Okay. I'll be here.
This is the first time you'll be using the sterile gloves, right?
But you know how to do it.
Yes.
Okay. Then now, since this one is okay, now I'll sort out these. I'll tell them one for one, right? Okay, I can correct this situation. So don't panic. Aye. Yeah, some people have cried. Now 2 fingers are falling in one. Then we'll be watching you. Okay. Drop that one. What else do I need here? I left this other part. I think cotton was supposed to even come here. Get a drum. Or, yeah, get the sheet of, check the drums first.
Whatever he's saying, the drum, if the drum is there, since him has gloved in, right? He's not supposed to touch there. So
Just check for it. Check for cotton.
Yes, what?
So,
there's another drum, the small drum.
small. Even goes, I'll need it.
Cotton swabs.
Let's see. That's what I want.
Okay.
Open it. Get the check of strips.
Procedurally, please, procedurally. Get 2.
No, you should be the proficiency by now. Move fast.
Both of them?
You can put one back.
The one you're not using.
Then get the swabs. Bring so I can receive them. Okay. Okay, then goes. So this, if I'm gloved, I'm free to touch this thing. Okay? If you are not, sometimes when dressing, I'm sure you've been taught the types. Sometimes you may need to. Okay, thank you. So I'm still watching her. Even when putting back, you lift that one, you put them back together. Right? Okay. So I have what I need here. So the next thing is I have to drape here, right? So remember what we did. Again, same thing. I'll unfold this from the trolley just in case something falls. Okay. Which one is more sterile? The one closer to me or the one on the other side?
On the other side.
So, which one is supposed to be in touch with the patient? The one that is closer to me or the one on the other side?
On the other side.
It's the one that's supposed to be in touch with the patient.
You can do the right thing.
He's getting upset now.
Which one is supposed to be closer to you? The one which is closer to you is what? Is it?
Or which one is supposed to be up?
Which
Which
is
one is
most
supposed to be
sterile?
up? other side. That's the other side is the freezing.
The one which is closer to him, is it more sterile or not sterile? More sterile. The one which is closer to him is the one more sterile?
No.
Yes. So now which one will go to the patient?
I'll get upset on
This is the
camera.
reason why you scrap now. I'm asking for the last time. Which one is supposed to be on the patient?
Mr. Wayne, we don't want to hear that fight. The one that is closer to me is less sterile.
Yes.
So the one that's supposed to be up is this other side, because anything that falls on this other side, I can reuse because it's still sterile. So that's why the one that is close to me is the one that... No. Stop lying. So I'll make sure that this area remains like that. So I can actually even move a receiver and put it here so that I don't move up and down. Clear?
Yes.
Okay. So let me just prepare this. Even this one, there is a little story that we need to understand. We are using Vicryl, unfortunately. Vicryl is for inner tissues. Right? So we need to, when we are, sorry, I'm not supposed to move away from here, but just for the sake of demonstration. Right? When we are, again, remember, ring finger, the thumb, right? So when we are mounting this here, we divide the needle into 3, the thirds, right? So if I divide it, where I'm holding actually 1 is here. The middle part here is the second one, the last part is here. So where from the stitch, I take 1/3, where 1/3 is ending, that's where I'll clamp, right? I'll clamp it from there so that I have enough of this that should go through the tissue of the patient. Again, it's just the tip that should go here. Sometimes in theater, you may have tissues that you are suturing. This is not supposed to go like that. Have you seen the difference? So it should just be the tip enough to hold there. Yeah, it should be there. Okay? Alright, so this is prepared. Of course, wound dressing we said should start. Alright. So just for the sake of me feeling that I don't want to start touching here with this glove, I may just use one simple method where I'll need to. This one can be used like that, but that's not what you are doing when you are doing the simple suturing, right? So this one, when I use it here, I'm not going to take it back, but I can reuse later on. So I'll clean the wound, okay? Clean the wound, observe it, check, is there any infection and the like, then throw away this. Because this I can still use it, but I don't want it to go back because it came here to the patient, right? I'll keep it here for now. Then I'll get, there's something more that I need. Give me the syringe and the needle. So opening of the syringe is the same way. Get this big one. Put on this. The same way you open the suture. So if these are here, you don't have to come anywhere here. You stand here. Right?
Yes.
Do you approach places like this like that? The way you are coming. So, needle. Let's move quickly. How many minutes are we like?
Both mechanics, please.
So open the same way. Because even these things that she's giving me, we are rushing so that we go within the 25 minutes. You check the expiry date. Everything that you are getting. Eh? Another one, another needle. We'll get the reason for this. Then get lignocaine. The drug is lignocaine that we are using. So before she gives me, she has to show me this is lignocaine. I'll check the expiry date so that after giving the patient, we don't want if the patient reacts, then we start saying, she gave me something else. How do I receive something else? I'm responsible for everything. She has to show me that this is lignocaine. So what we do when getting this lignocaine, again, we need to swab this top part. If anything, we're supposed to have something that is intact, closed, and everything else, okay? So, for now, since it's open like that, you show me, you put it like that. Give me this tip. Do it's like that, but then you do this one. Yes. So when she does that, I'll swab the part where I need to inject. Right? To make it sterile, okay? Throw it, then get your, so bring it closer. Then you turn it. Up, go up, up, up. Draw this, yes. Okay, get the amount that you need. Okay. Okay, you can put back, thank you. Everything that you're supposed to do is done. Expel all the air from here, right? Yes. So when you're doing this, you actually, I don't know if you'll be able to see. These are the wound edges. Okay, imagine this is the wound here, right? So what I'm going to do is I'll inject in these wound edges, right? Or start from up where there is no wound, push the needle. When I push the needle in, I'll withdraw, right? Why am I withdrawing first? I want to check if I'm in a blood vessel. We don't give this drug in a blood vessel. Right? Lignocaine can cause hypotension. Right? Others, depending on the type, can cause hypertension. The patient can go into shock. Others can cause hypoglycemia. Right? The patient may die before you even finish. Cardiac arrest and the like. So that's the reason I will withdraw first, check that it's not in a blood vessel, then push back the drug if it's not. If I'm in a blood vessel, blood will come in. Right? If I'm not in a blood vessel, nothing will come, so then you can. It is called local infiltration, so if this is the area that I'm supposed to put in, I'll push here, inject, withdraw, go on the other side, push in, withdraw, check if I'm in it. Whenever I go into the tissue, I have to check, ensure that I'm not in a blood vessel. Right? So all around the wound, we call it local infiltration. That's what is happening here. I'll inject, tell the patient it will pain a bit, but later on it will be numb so that when I'm suturing, it is not going to be painful. So that's what happens. You push in, withdraw. I'm not in a blood vessel, push in the drug. Go on the other side, just like that. So don't start jumping because the patient has this wound. The wound is actually more painful than the needle that you are pushing in. Okay? Give someone a seat. Give someone a seat. They want more your stand. Okay. Let's continue. Okay, so after I've done that, I'll give it a minute. Oh, can we pause? Is it possible? Okay. So, I'm sure we all saw how we are supposed to do the local infiltration. You give it 2-3 minutes so that the drug can start working. Right? You can even try with the needle, or you can touch the patient with the needle, just as the patient. Are you able to feel any pain? Then if the area is numb, the drug is working well. The patient will tell you there is no pain. There's one thing that I didn't do that we should just correct here, since other people will be learning from this. When I drew the drug using this needle, I don't have to use the same needle for local infiltration. So I removed it, and this is the needle I used. You saw that, right?
Yes.
Before the incident that we had. So you use another needle. So that we are done, then you start now your actual procedure that you are doing, simple suturing. Okay, so you get your, remember, ring finger, and because these two, they will be helping you, you will stabilize very well as you are working. Right? Now, I hope people will be seeing, or where should I stand so that people can see the other side. Now it's going to be a bit difficult. Okay. Let me just stand the other side, but I'm supposed to be this side. Forgotten one thing. Tooth dissecting forceps. This is a forceps that we use. It has teeth, right? We also have non-toothed, which is flat. Tooth dissecting forceps is used for tough tissues. The skin is tough, right? So non-toothed, you use it for soft tissues, like the ones that are inside of the body. Some of the tissues. Okay. So what you do is you start from up there. Okay, I'll pick my tooth dissecting forceps. I'll slightly go into the wound. I hold this part of the skin, push the needle down. Remember, the patient is not feeling any pain, right?
Yes.
Then, once the needle is out there, I'll use this same forceps. As I hold, I remove this. I think how to remove also, I think that's another skill. We'll just talk about it. This cannot lift since this is tough. We are using a mannequin. Pull, go up like that. Then you can hold here. See what is happening here. Because one day you will suture someone, then later on they will come back that everything is open. So this one will point up like that. Right?
Yes.
Then if you want it to be stronger, go around twice, like 1, 2, right? Then I'll open, pick this other one here, right? The knot for it to be stronger, the one that was this side, this will go, the other one will go the other way, the other one will come the other way. Okay? So, then, the stitches, according to your procedure manual, you've been told what you are tying should be on the side. They should not be in the middle of the wound. Right? So, if I'm pulling this here, it means that all the tie, the knots are supposed to be this side. It's not a fashion, one here, another one here. Then when you look at such a patient, the one who was doing it didn't do it correctly. So again, I'll just do now. Since this is twice, I will be going with one. Remember, the one that is this side will come here, then this one will go this side. That's a knot that will hold. Okay? Pick, then the knot here. Just twice, this is enough. Okay, I was supposed to have just a receiver here. Let me pick. Because now it says, if you were somewhere, you would have your assistant cutting for you, but this is your procedure. You are just with the assistant who hasn't scrubbed, they can't hold anything. These are supposed to be here, but for the sake of demonstration, so that you see, that's why I'm saying this, I'm doing this. Then this should be at least not that long, not that short, because remember, suture remove also is another procedure. You need this, right? When moving. Okay? So one is done. Remember, just a third from where the stitch is. Again, tooth dissecting forceps just to help you. So there should be at least 1 centimeter in between the stitches. Okay. Comes out here, hold it. Remove, pick this. So that wasn't okay. It happens even when you're doing this on the actual human being. So, pull, 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 pull. Remember, the patient is not feeling any pain. Pull all the way like that. 1, 2. Hold that. Tight. Again, 1. Pick. So you should try it when you are doing your return demonstration. Do it like that. Then try to tie it. It will not hold. So I'm saying this should face up. Okay? Then pick this. Then tying should be, what we are simply doing is what? We are approximating the wound edges. It shouldn't be too tight. Because if it's too tight, what will happen is the inner structures in there, the inner tissues will come out like that. If you tie too much. Again, if it's too loose, you haven't done the job because you haven't approximated the tissues. Okay? So it shouldn't be too tight, again it shouldn't be too loose. Just ensure that the tissues are nicely approximated. So this is the beauty about this drape. It is sterile, you can work from here as well. Okay? So if we did not have Pastor Bruce around, I was going to ask someone to come and have a feel, do one. But during your written demonstration, I think you tell me the time you come here, I'll come and check what we are doing. We'll still correct these things because one day it will be posted somewhere where there is no clinician, you are the only one who is doing everything. This must be known. And don't run away from the patient because the wound is looking in whichever manner. Right? Again, 1, 2, get this. So just remember, this one goes the other way. The knot is always here. Okay, I think 3 are enough for this demonstration. I can have my everything here. So just check the way it is and we'll continue with the other stuff. Then I can get another swab, dip it in the solution that we are using, and just clean around, right? Do the cleaning. Once the cleaning is done, get a dry swab. That's according to your procedure manual, okay? A dry swab, put it there. Strapping is there. As I was doing this, I would have even asked my assistant, just give me some strapping. So strapping ready, you strap, then the dismantling procedure, I think it's something that we know. Do you have any questions? You have scissors there. My assistant will go to lumbar puncture next time in the next 2 weeks. So you will still be my assistant and I want to see improvement in my assistant. So just cut with the scissors, cut a bit so that you, yes. And then go all the way. Oh, you haven't yet been to the clinical area. You will go and find people that they don't even use this. They don't even use scissors. Okay, this is enough. Cut. Another one. It wasn't short. But anyway, let's do this. So once this is holding, you can remove your dressing the drape. This is already. Oh, she's even doing something short. Okay, so once this is holding, we are okay, we are good to go. The wound is covered. Just ensure that you strap it well. Everything secured. Thank the patient. Right? For the cooperation. We'll be coming to do this. Or you give IEC regarding wound healing and everything else. Then remember, this may be an outpatient. The patient may be going home. Tell them to come back after between 5 to 7 days, depending on the 5 days. If the wound was not that bad, if it was bad, up to 7 days, the patient should come back for suture removal. Why are they coming back for suture removal? Tell them, even if the wound looks nice, these things should be removed. They are foreign material. Should it go beyond 10 days going up there, there will be some infection there because the body will start reacting to those foreign materials, the suture. So they need to be removed. So suture removal is another procedure. We may need to come and go through that later. Okay, any question that far? Dismantling procedure, same as the one for wound dressing. Any questions? If you are not asking, then I was just talking to myself. Questions?
That solution they receive vaccines or not? Okay, and ask that solution, the one that you're supposed to put the used faucets. So here under especially you're not putting anything since there will be no cleaning and any use of those forceps and removing of them.
Okay, for this one, we are not doing this like I'm not preparing you for OSCE exam. I'm preparing you for practice. Right? And hence, what you learn from here, that's what you are going to do when you go to the clinic, when you go to the hospital. Then, so I think what I said from here, I said the next thing after you are done, it's the dismantling procedure. So it's in the dismantling procedure, that's where we do what? Anything that went in contact with the patient. If this is jig, I'll put these instruments in jig. I'll tell my assistant to take note what's the time in jig. For how long are the instruments supposed to be there?
10 minutes.
10 minutes. Beyond 10 minutes, we are destroying the instruments. All these sharps, that's why I just said the dismantling procedure follows. For the sharps, even this one is a sharp. In fact, what you're supposed to do here, where's the scissors? Let me just show you, since we have got this sharp. Remember the sharps container was mentioned somewhere. Yes. Cut this short, because if you just throw it like this, this is the sharp. You just throw it like this, someone will come and hook in here, then the needle will follow it. Right? So cut it short so as to ensure that whatever that you are throwing in there goes into the sharps container. Then don't have that, when you're picking this, don't use your bare hands, please. Carry a forceps just to pick this to avoid injuries, right?
Yes.
So pick that, discard. So anything else, this will go into the other those other buckets for decontamination. Decontamination continues like that. So this is the sharp again, throw it away in there. Then the rest you go to the treatment room, finish up the dismantling procedure. Yes?
So I have a question. Like when giving the injection, what angle is supposed to be?
What?
When giving the injection.
They're just giving this like in the subcutaneous, 45 degrees is okay. Just like you do for, you haven't just covered maybe diabetes mellitus, like for insulin. Right?
Yeah.
This is the skin, that's 90 degrees. Right?
Yes.
Now I'm infiltrating right under the skin, 45 degrees is okay. Right?
Yes.
You infiltrate the area, wait for 3 minutes like we said, then when the area is numb, the patient is not going to feel any pain, you can start. Okay? We have no more questions.